the specialist was saying, even if the research is now showing this, still advising people to rely on the advice of their pediatrician.
That's right.
And so we still would want to say to people that you would want to discuss it with your pediatrician before embarking on it. Yes. Yes.
You definitely should, just in case. And like it said, you should definitely go to your specialist office if your child is at high risk.
Yes.
So, Nona, thank you for being here today.
Well, thank you for having me. Good morning, everyone.
So what's your thoughts on the peanut allergy?
Well, I do think overprotection can be a problem, and so if you should probably just try and expose children to a very wide range of foods. If you do notice a reaction, then of course consult your doctor, because you don't want to be irritating or overloading their immune system. However, there's no real reason to just avoid stuff without trying, I would think.
Okay, very well.
Right. So Noel, we are so happy to have you again. I think we have a caller. Good morning, caller.
Good morning.
Good morning.
Good morning to you.
Good morning to you, my friend. How are you?
And yours. Very interesting program.
Yes, thank you.
And I like what you're speaking about allergies. And I'm requesting to let the doctor know, taking the doctor's advice, asking questions. Because here in Barbados, we had a few articles in the papers from the doctors on the news where people like diabetes and those people who have serious illness are taking what I would say over-the-counter drugs and leaving out the drugs that they're supposed to take, and then getting complications. That's why we've seen a lot of sudden deaths because they stop using their normal medication and using what we would call herbal and
alternative
other things. Alternative medicine. So it's something interesting you're speaking about, and as you say, you should ask your doctor advice. So may God continue His blessings be upon
Thank you.
you all at Jolly's.
Yes.
And the station. And Pearl, good morning to you.
Good morning to
and
you.
Yours and my best friend, she's the radio announcer, Cassandra Crawford. Her son named
Leon.
How's your son named too?
Okay, wonderful.
Okay, bye-bye.
Take care.
Take
Bye-bye.
care. Thank you. So that's our friend from Barbados. She calls religiously every Wednesday, so we're always very happy to hear from her. So, Nona, I wanted to ask you, we're talking about self-management of injuries. How would you define that?
Okay, so first of all, you always have to bear in mind that when something happens, there's one of two things that could be. It could be sinister or not. Sinister situations would be those that put your life or the healing process at risk. Okay, so if something's broken, there's no self-management. You have to go to the hospital. If you're having an acute allergy, there's no self-management. You have to go to the hospital. So once you're able to more or less function despite the allergy, then you can start to think, okay, maybe I can handle this myself. So then you would try a couple of things. If nothing works, then you still have to go to your doctor. So everything we're going to say from now applies to injuries and situations that are not totally debilitating.
Okay. And that's great that you stated that from the
Yes,
onset.
yes,
Because we don't
yes.
want people to think
that they can do everything.
Exactly.
Right.
All right. So why would you say it's important for somebody to self-manage an injury? I think it's important because education is number one. If you have, something going on, educate yourself and try to see what you can do. But why do you think it's important?
I think it's important because when you do sustain an injury, the longer you let it linger without doing what's needed, then the more it affects the maximum recovery, so to speak. So for example, no matter what injury you get, most injuries will give you what is called inflammation. So inflammation is a combination of signs. So you get swelling, you can get heat, so you might not see the swelling, but something might just be hot, and that's a sign that there's inflammation happening deep inside. Pain is also a sign. So for example, if you get a bruise, it will swell, it will get red, it'll be hot, and it'll be painful. So once you realize one of all of those signs, then what you need to do is apply every parameter that you can to reduce inflammation, because healing can only happen once inflammation has stopped. Okay, so for most injuries, it's okay. It will probably take a week or so to completely clear the inflammation. If you let it last longer, then it makes it harder for the body to repair.
Okay.
All right. So, I mean, for those listeners who may not know you or know what you do, you're an osteopath.
That's right.
So just basically tell us, for the sake of the listeners, what it entails and
Sure.
Yeah.
No problem. So osteopathy is a type of manual therapy. It's considered an alternative medicine at the World Health Organization. So what practically it is that we have a set of tests, physical tests, so using movement and palpation to assess imbalances in the body. So the best way to damage something in your body is to overuse it or underuse it. So let me explain the underusing part first. So if you have a cast for a number of weeks or months, once it comes off, you'll see that the muscles have shrunk. And that's disuse atrophy. So the same thing can happen, for example, in cartilage. So if you have a joint that never really gets enough movement or pressure and distraction, then the cartilage will kind of damage. It'll shrink and shred and all that. So that's one. And then the other side, which is the most common event, is that you overuse certain structures. So if you slouch at a desk, sit badly all day, for example, then you're putting strain on your ligaments in your back, and that causes inflammation and pain.
And that's interesting because, ever so often people come to the pharmacy with skeletal muscular problems, and it would seem that many of them are trying to self-manage. They would come, they fell off a bike, they were walking and they slipped on a piece of banana peel, and this is happening. Sometimes we've had, once we've done the assessment, we would say, well, okay, you may need an anti-inflammatory agent, you may need something to rub or so. Sometimes we have to say, well, you definitely need to have further investigation. You may have to do an X-ray to actually see, conclusively what has happened, And so I like the first question Pearl asked about self-management. As a specialist that relates to bone and movement and so forth, what advice would you give to people who sometimes procrastinate after they've had some type of skeletal muscular injury, and they may be reluctant to seek the care of a healthcare provider or intervention of a healthcare provider? What would you say to them?
Well, I'll say
so what type of injuries that really would definitely involve the assessment of a healthcare provider, and which ones may not necessarily,
Okay. So as we said at the beginning of the show, if the injury prevents you from functioning, so if you cannot walk because of the sprain, then you need it checked immediately to make sure nothing is broken.
That's a nice point.
Right. I think that's the number one. That's the rule of thumb. If you cannot function at all, get checked out right away. Then if you can sort of function, but you're not feeling great, then you can try self-management. And I would say if you give yourself a week and things get better, then okay. But if they don't, then you still have to get help. So now in terms of self-management, general rules would be, so if you have swelling and heat, then you would need some kind of cold packing. Okay.
So can you say this again? Because that is sometimes a bit confusing, where people want to know, when do you use cold compress, when do you use warm compress?
Okay. So if I start with warm compresses, so heat, will cause dilation. So heat is most useful for muscular problems. So if you have a tight muscle, a spasm, a cramp, then you put heat, and that will relax it, bring more blood flow, soften it, and that is usually helpful. So for example, if you wake up with a stiff neck, sometimes you sleep badly and your neck is kind of stuck, might call it a torticollis, then that can benefit from heat. So you would make sure you put the heat pads on the muscle, not so much on the joints. As a general rule, you want to avoid heat on joints. Okay.
Okay.
So that's for heat.
Why do you want to?
Because heat causes dilation,
Okay.
it could increase swelling, and we don't want joints
To swell.
swollen. That's right.
Okay.
Okay. So if you have a doubt, just use cold, and cold packing will reduce the blood coming through, so that reduces the swelling. That's supposed to help stop swelling, and you're supposed to do it 5 minutes at a time, so not too long. I've seen people with burns, like literal skin burns, discoloration and everything, from using too much ice for too long. So if you're using ice from the freezer, you have to wrap it in cloth, and when you put it on, it just has to feel like a calm, cooling sensation, but it mustn't feel like it's stinging. Otherwise, you're creating more damage.
Oh,
Okay.
that's
Okay.
some real
That's
good
very
points.
interesting. And when you do put the cold compress on, how long should you leave it at a time? Because I understand that there are intervals.
That's right.
that
So
you should-
5 minutes is usually enough to get into the tissues,
Okay.
and then you take it off.
And
let
you
the
leave
body-
it off for another 5. So
So for people who I only recommend cold, I would tell them to do it 5 minutes every hour if they can. There's also such thing as, I think they call it Scotch baths. So you alternate cold and hot compresses.
Okay.
You would start and finish with cold. So what that does is it's supposed to create a pumping action. So you put cold and you tighten the blood vessels, you flush everything out, and then you put heat, so dilate the vessels, bring blood in, and then you put cold again, and so on and so forth. So
and
that's
how long would you do that for?
5
Or how many
times.
times?
So
Okay.
cold, hot, cold, hot, cold.
Okay.
Mm.
Okay. Interesting. Very interesting.
very interesting, because I mean, people have oftentimes asked me, when do you use cold compress versus hot compress or warm compress, and sometimes it was now that I know better, I would be able to give them the right
Now,
information.
as we're on this subject, what's your take on products like Icy Hot and those kind of creams that create that heat kind of feeling?
Well, again, if the predominant sensation is heat, I would mostly use that on muscles.
Okay.
So imagine you have, imagine you have heel pain. Often it happens because your calf muscles are tight. So I wouldn't put the cream on the heel, because that's where the inflammation would be. We would put the cream on the calf muscle to relax it and stop it from pulling on its attachment on the heel.
We have a caller. Good morning, caller.
Good morning.
Hello.
Good
Good
morning to
morning.
you. How are you?
I'm here again.
Okay, there.
Very interesting. What the lady is saying is so true, because I got stung by a centipede and I had to attend the hospital. But I started using my own things like onion, and they say you can use onion. And when I went, the doctor told me no. She told me I should have used ice. So she's so right when it comes to swelling, and even I have a problem. I had a fall at work, so it's affecting me now. When I go to therapy, they use hot and cold and then massage. So she's
Yes.
so true in what she's saying.
Yes. Thank you. Yes.
Yeah. So that's the thing. Knowledge is important, because then you would know when to use what.
That's right.
So of all the herbs that you have at home, you would know at which point to use. So for example, we have herbs that would be called coolant, I think people say that, rafraîchi, and they have all kinds of names. So those usually are herbs to help drainage of fluid. So if you have swelling, then that would be a good time to use. You still use your ice, but you can also use that kind of.
I have
kind
another
of herb.
question for you. So, my son is riding his bike and he falls and seemed to injure his hand. At what stage would you say he should immediately use a sling, or lift the hand down.
Okay.
Let's say there was no broken bone.
There's
or
nothing
anything
broken.
Yes.
Okay. And if the limb can move, if it can do its full range of motion, then we want to preserve that, because anytime you immobilize a joint, you're putting it at risk of
Stiff.
remaining, that's right, stiff. So even if there is some ligamentous damage, what you want is to continue moving and using the range of motion that's available without acute pain. So it might be that you just need to restrict the very end of the range of motion. So to that purpose, I've been using tape, which is available at Jolly's, by the way. So it's a particular type of tape which is elastic and it sticks to the skin. The idea is that if you hold your skin, pinch and pull, it actually will pull on everything around it and deeper. So if I'm trying to protect the ligaments of my wrist, if I tape the skin of my wrist tight enough, then I'll be able to move the wrist. But when I get to the end range, I will feel like it's pulling on my skin and preventing me from reaching the very end. So that way I know I'm not going to be stretching the ligaments all the way and damaging them. So for a sprained ligament and a mild sprain like what you seem to be describing, we would do ice, and then we would put that tape on to allow the person to continue functioning without re-injuring.
That's interesting. Would you also use that for somebody who has, let's say, lower back pain?
Exactly. So lower back pain is often due to inflammation and ligamentous sprain, but in the back. And those are small, deep joints, so we can't really see them. And we don't really think of a back pain as that kind of injury.
Right. And I'm looking at you like, inflammation? Like, where is this coming from? Though? Where does it come from? Where does it stem from?
Okay. So, if you sit cross-legged for a long while, when you come to stand, it hurts. Huh? The joint might feel stiff. So what happens is, depending on how you sit, you put strain and stretch on the ligaments, and that creates micro tears, and any kind of tear will then cause inflammation. So extra blood will come to the area to try and get things fixed, but in the process that gives you swelling and pain and everything that we described. So when you sit, if you sit badly for hours, or if you have a job where you're doing repetitive bending or twisting, then you repetitively put strain on that ligament, not enough to completely destroy it, but you're creating micro tears and the inflammation builds up. If you keep doing that every day, then there's never enough time for the ligament to repair, and you end up feeling pain all the time.
But a lot of us work in offices, a lot of us sit down, a lot of us drive to work. We have bus drivers that are sitting down all the time. So you're saying that at some point there is going to be some wear and tear?
There is. So there are also ways to prevent that. So again, knowledge. If you know what causes it, then you can do things to prevent that.
Okay, but we have a caller.
Okay.
Good morning, caller.
Good morning, caller. Good morning, caller.
Morning.
Good morning to
I
you.
would like to know, what do you take for inflammation? Because I have inflammation in my both feet.
Yes.
Yes, thank you.
Are you welcome? All right. And that's a good question.
So if you want, you can answer that, but I'd like to know what the preventative measures
Okay, for the
are.
back?
Yeah, for the lower back.
So number one would be maintain a healthy muscle tone in the back. Because I'm seeing funny looks. So the idea is that when you slouch, your back takes this C-curved shape, and that is what stretches those ligaments. So if you're able to sit upright, then you don't stretch the ligaments. To do that, though, it has to come from the muscles, and they have to be toned enough for you to be sitting straight without thinking about it, because posture is an unconscious thing. So you're at work thinking of what you're typing or what you have to do. You're not thinking of how you sit, and that's normal. So you have to find a way in your daily life to exercise those muscles. They're quite small and specific, so it might be worth getting help from a trainer, at least for a couple sessions, so he can explain what to do, and then you can do it on a weekly basis or maybe a daily basis.
Okay.
That would be one thing. Second thing would be to make sure you eat collagen on a regular basis. So our elders would have that habit of eating franchine every Saturday or bullfoot soup every Sunday or something. And those foods which have bones, ligaments, tendons in them, a skin. That's where they are sources of collagen. And collagen is a type of protein that your body cannot make from scratch, so you have to eat it. And that's what it will use to repair itself. So you go out and you do some gardening all day, you're a little sore towards the end of the day. If you have everything your body needs, then it'll fix it and you should be fine next day.
Okay.
So collagen rich foods would be frashine, souse, bullfoot, that kind of stuff.
Very, very good. Okay, now this lady called and
Okay.
mentioned the inflammation in her feet. What can you say to
Right.
that?
So again, there are different
Types
of
inflammation.
feet inflammation. So if it's anything to do with diabetes or a heart condition giving you swelling in your feet, then what I'm going to say might not be helpful. It might contribute, but you do have to address the underlying cause. Okay, so if you have swollen feet, again along the line of using cold to chase inflammation and swelling, you could try cold foot baths. So in a basin of water, you could put maybe a little bit of ice if you can stand it, otherwise just cold water, and let them soak for maybe 10 minutes or so.
I'm shaking
The
because
nerves.
I prefer to soak my feet in
Well,
really hot water.
Of course, it's more
'Cause
relaxing.
It just feels so good. But
So you'd have to think of that as a treatment, huh? Think of it as a medication. So definitely, to give you an idea, athletes do that a lot. So after a strong workout, they would soak their whole body in an ice bath to just shunt any inflammation that could
down.
be. Yeah.
Wow. Okay. Because it actually shocks the system.
Yes.
Yeah, closes all the
Okay.
vessels.
But you also, for the color, I also want to say, if you have in swollen other feet, it can mean other things as well. So if you some medications can cause fluid retention, so you want to, that would have to be assessed. Heart failure can also cause swelling in the extremities, particularly the legs. If you have neuritis, particularly that's one of the conditions diabetics would normally get, inflammation of the nerves. So there are other reasons that the inflammation is just a byproduct of what's happening on the body, and so you definitely would still need to have an assessment done before you can conclude that I'm just using some type of therapy. Okay. I wanted to ask you though, many people are of the opinion that if they are experiencing back pain, that they should lie flat versus the bed. So you put your mattress down and lie flat on the floor versus lying on the bed. Does it make a difference? Is that factual or is it just merely psychological?
Okay, there are two things about lying down with back pain. The first would be you don't want too soft a mattress, because if you end up with your back in that same C shape in bed, it's as if you were slouching all night, and that will increase the strain on the ligaments and cause more pain. So you must have a firm enough mattress for your buttocks not to sink in too far, to have a rough idea. The second thing, the position that has been shown to help relieve back pain is lying on your back with a few pillars under your legs. So the thighs would be raised, and that restores the normal shape of the lower back, which is slightly curved, and that's normal because that will like take the stretch off the ligaments. So those are the two things. And with respect to bed rest, it's very rare that back pain requires complete bed rest. There was a study in the UK done, I can't remember the year, but because back pain is causing a lot of loss, financial loss to people and to companies, then there was a study to find out what the best practice would be. And it turns out the best practice is pain management. So if you're in a lot of pain, then by all means you will need to use painkillers. Associated with that, you will need some kind of therapy, manual therapy, so conservative treatment. And they recommend no bed rest, because if you bed rest, then you lose more muscle, which means you have even less support of the back, and it just feeds a vicious cycle.
Yeah, but what about for somebody who has a slip disc?
Yes.
Well, a
that's
slip
quite
disc,
serious, isn't it?
it is serious. So the extent to which you would probably need to stop everything is if the slip disc is causing so much compression to the nerves that you cannot walk. If you get to that stage, then you need surgery to decompress the nerve, because nerves are fragile. So extreme compression can damage it, and you may lose the use of that limb and nerve, so you would have to get that. But hopefully you will have assessment and treatment before you get to that stage, because it's very rare that this stage happens immediately, overnight, or
So
just after
degenerative.
one event.
That's
very
true.
interesting. Very
That's true.
interesting. And I like that you mentioned about the vicious cycle that will
That's
continue to
right.
happen once you continue resting.
The natural cycle would be you damage your ligaments, and after that the joints are looser, so you will one day bend up to pick up something and just stay stuck because the joint went a little too far, and the muscles tried to kick in and protect, so they locked everything up, and then the muscles relax. You use some oil and heat and this and that, and relaxes, but you still have extra loose joints. You go on, do your normal activities, and at that point, when you move, the ligaments are not stopping the movement, the joints either, and what's happening is the discs, which are deeper, they end up taking the stretch every time you move, and that's how you end up damaging them. So a slipped disc is really not slipped, it's just a torn, damaged and swollen disc.
I mean, even motions like leaning over the sink to brush your teeth and bending over to tie your shoelace, even those things, do you think that over time they can cause wear and tear as well?
They shouldn't. If you already have wear and tear and you do them, they can cause pain.
Okay.
But normal, bending over a sink is not much flexion at all,
Okay.
so that shouldn't be a problem.
Okay. All right.
I was told one time by a therapist that if you are picking something up, you should have one leg out and one leg. It's like you supporting your line in the back rather than just bending over and pick up the object, particularly if it's heavy. So it's almost like, maybe if I demonstrate it, maybe you'll be able to explain.
Okay.
So for example, if I'm picking this pen up, right? I have to do that rather than that.
Okay. So
I don't know how you call that position.
I agree with the fact that if you're picking up something heavy, keeping your legs straight and just bending over and coming back up is a bad idea.
But what about if you're picking up something heavy and you go into like a squat position where your back is arched? Is that?
That's perfect.
Oh, okay.
So that's what you're aiming to do if you're lifting something heavy.
So you'd have to open your leg. You could either open your legs
And
like
the
a squat.
the key thing would be to bend your knees and keep your back straight. So what you showed me there, you weren't standing in a wide stance. You were more in a lounge kind of stance.
Yeah.
But you bent the two knees were bent and your back was fairly straight. So
yeah.
that's what we're looking for.
Okay.
Okay, as long as the back is
We have a
straight.
caller.
Well, we
Okay.
did, but if you'd like to call back, we're here. We're ready to take your call.
This is good. I also wanted to ask you, based on the clientele that you've seen and the information that you have you seen skeletal muscular problems more prevalent in women than men? And what is the if there is any new research that has shown, because a lot of the skeletal muscular problems that we've seen in women seem to be attributed to the reduction of estrogen as they get older versus men. So you see more women using canes to walk and complaining of skeletal muscular problems than men do. And they're saying that it could be associated with the women bearing children and all these different things that would have gone.
That's interesting. I can't say I've noticed that. And I seem to have in mind that women usually have a slightly longer life expectancy. So I'm not sure. I'm not sure about that. But in my daily practice, I see roughly the same presentations
Okay.
regardless of sex.
Okay.
It's more to do with occupation.
Okay.
Okay.
Good morning, caller.
Good morning,
Good
caller.
morning.
Thanks for
Good
your
morning.
patience.
Good morning.
morning.
Good morning to you all.
Good morning to you there.
Very interesting program.
Thank you.
Carlton, you were speaking about bending and pick up.
Yes.
You don't bend over and pick up.
Yes.
You need to go across, put a foot at the front and one leg at
Yes,
the back.
that's what I
exactly
demonstrated.
what he
That's
did.
what he
That's what I did.
demonstrated.
But you have to do it in a proper way
Yes.
for you not to mash up your tissue of your back.
Yes.
And when you're lifting up, you need your knees to help you to lift up the weight.
Yes.
You don't go lifting up the weight one side. You destroy the tissue of your back.
Mm-hmm.
We do some training on that.
Ah, good.
Yep.
Good,
So you
good.
have to put yourself in a proper angle to lift up the load.
Mm-hmm.
And some of us, when we're bending, let's say we're doing some cleaning, we like to bend over. When we get up, all our weight things.
Yes.
If then pain in your waist,
Yes.
you have to bend properly, like you're sitting down on your feet, like bend
Yes.
down, right down,
Mm-hmm.
and do your work properly. So when you get up straight, you don't feel no pain, no tissue destroyed.
Yes.
Very interesting program.
I appreciate you calling.
Thank you.
Thank you.
Welcome.
Obesity and skeletal muscular problems. I know that has been another hot topic. People who are obese are more prone to develop skeletal muscular problems. How would you, what would you say about this?
So weight will definitely affect mostly the lower limb joints. So your feet, the arches in your feet and your knees, possibly your hips also. However, you have to bear in mind that there are overweight people who are not in pain. So just because you're overweight doesn't mean you just have to take it in silence and suffer, So definitely, I mean, you should get on some kind of program to settle your weight. But you should also seek help because there are ways to prevent some of the damage that can occur because of the weight. See, so it could be the use of insoles, for example, talking about feet. It could be some kind of muscular electrical stimulation. So the faster and the stronger muscles are, the better they protect your joints. So if you can be heavy and muscular and have no collapsed arch and no knee pain. So I would say there are ways to maintain the health of your joints.
Okay.
Good.
We have a caller. Good morning, caller.
Okay.
okay.
High heels versus flat shoes.
So
6 inches and versus, I find a lot of our women now, particularly the women working in the banks, I find many of them now have gone to flat shoes. I don't know if you've seen that, Pearl, if they're stockings and they call them like dolly shoes.
Well, after a while, listen, if you're a teller and you're standing up all the time, your feet do end up hurting you. And then also, it's almost like you no longer have an arch. By the end of the day, your feet have just kind of collapsed. It's a lot to deal with. And then you go back to high heels, and then you create kind of like the arch again, and then you're in flats. And then sometimes you need a relief from the heels if you're on your feet all the time. Some of them do get the opportunity to sit, which is good. But I often look at, when I go to the supermarkets, there's one supermarket in particular where their staff, their cashiers are standing. They stand for hours on end, and that cannot be good for their feet at the end of the day.
Okay, so the problem with feet is when you have muscles which are too tight and that pull on their insertion on the bone and on the ligaments. So for example, when you wear high heels, your calf muscles are in a shortened position. So if you really never take time to stretch them back, then they chronically shorten, and then you'll come to a hike on a Sunday or just do something in flat shoes and it's a little bit strenuous, and the tightness of that calf muscle will create too much tension on the heel and give you heel pain. That's an example. So that's one thing. If you do have to wear heels because it's part of your outfit and because you like it, then that's fine. But you would have to find a way to stretch your calves at least every night and during the day if you can. The other problem with heels is the fact that the front of the foot is squashed and there's extra, and a lot of the weight of your body is on the front of and the ball of the foot instead of being spread out between the front and the heel of your foot. So that part, I mean, there's no amount of stretching that can change that. So if you would have to limit the amount of time you spend with all that weight on the front of your foot.
And what about for people who are constantly wearing flats?
Flats, I think the main thing to look out for would be the hardness of the flat. So again, if you're standing a lot, you might want some cushioning. That's right. And you also want the shoe to hold on to the foot at the heel as well as in front. So flip-flops, if you're just standing, it might be okay. But if you do have to walk up and down all day in flats, you want them to grip to the foot, because otherwise your toes have this extra job of keeping the sandal on your foot. And that causes spasm and shortening and all the problems we spoke about.
So it's better if you to wear a shoe where your toes can move.
It's better to wear a shoe where you don't have to, where it doesn't flop. So you have sandals with a strap around the back of the heel. That's what you want. Instead of a shoe that you have to be
constantly using your toes
that's
to pull
right
forward.
You can see women know what I'm talking about.
I can imagine because my son does it. If he's wearing flip-flops, he's always pulling the flip-flops forward with his toes. You can see. Oh yeah.
Very, very informative. There's many things that I've learned.
Well, we're kind of down to the last minute of our program. We wanted to give you just this last minute to share any information with the wider public that you feel that they should know on this topic or anything else.
Where your office is located for those people who may want to meet you and,
Sure. Okay. So I think the main message of this show was probably that once you know that you're not, that what you have is not sinister, then self-medication is okay, self-management is okay, within limits. So within a week, you should have some kind of difference. And if you don't, then you need to seek help. So for musculoskeletal problems, you might be able to do ice and heat and those things. But if it comes to setting joints which are stuck back where they need to be, or protecting ligaments using tape, you might want to get professional help, and this is where I would come in. So my office is on Fort Lane, it's number 4, and the best way to get an appointment is to call or WhatsApp on 285-5592.
Okay.
And that office is close to Domlec.
That's right.
Domlec, where you pay the bill.
Exactly.
Right. Very close to where Dr. Grell was.
So
because not everybody knows the streets.
The streets.
Yes.
So between that little stone
Close
street,
to Dr.
Cobblestone. It's like a little cobblestone lane.
Right. Close to those Freebur's.
That's it's a building. So the biggest buildings you'd see would be Domlec on one side, Wacky Rollers on the other side, down that road.
Very good, very good. All right, so we're so thankful.
Well, thanks for having me. This was a pleasure.
I know, because usually your schedule is so busy and so packed that we don't get to have this opportunity. So we do want to thank you.
But I'm happy to be there. I'm going to make time to do this more often.
Okay, great.
Definitely. Great. So, Dominica, here you had it. We had Miss Nola Lawrence, who is an osteopath, gave you some very informative information today. Until next time, I'm your host, Carlton.
And I'm Pearl Fontaine Butler.
Go out and do something positive. Bye-bye.
You were listening to Health Vibes, a production of Jolly's Pharmacy Limited.
Yeah.